when we started getting usage of the system, we saw, the notes are better, right? But what we didn't anticipate, which it surprised us a little bit, is that it does sort of then change how you see the patient, right? Because it can't see what's going on. It can't read your mind either. And I don't think we want to attach anything that can read our mind, right? That'd be a little bit too far. But it's listening in the same way like a scribe, a human scribe or a student, right? That maybe is taking notes for you is listening in. So then we noticed this, that people would start sort of mentioning things or focusing even more on the education of the patient and verbalizing that in a way that didn't previously, because they realized that it would get the note generated and it was something that was improving the quality of the care the person was getting in the visit. So for the objective exam, if you're looking really quickly and assessing the, a special test like a straight leg raise or something, they will just say like, okay, I'm going to do a special test now. It's called straight leg raise, okay? And it helps us, figure out if you have this diagnosis or that diagnosis, and they'll just kind of call it out, almost again as if they're educating a student, but in this case, it's usually just the patient in front of them. And that way the system hears it so it can document it. But the thing that was also surprising is that the patients really like it. When there's a lot of stuff going on in your mind, the patient doesn't realize all the clinical judgment and all the clinical skill that you're bringing to bear when you're seeing them in a visit. And by calling those things out, they see that there's so much more depth, that you're not just kind of like looking at them and doing a couple of things. You're thinking through a lot of stuff and it means a lot to you. And verbalizing it so that it gets captured into your documentation is also something that the patients then get to learn a lot more about their condition and what's going on, so that they get to be a much more engaged patient over the course of their care too.